Are you a foreign medical graduate or a final year medical student abroad who wishes to practice medicine in Ghana? Hello there and welcome to my channel. My name is Dr. Trudy. Today, I'll be talking to you about some of the things you need to know in order to practice medicine in Ghana as a foreign trained medical doctor. Please don't forget to subscribe to my channel and like my videos. Do well to share my videos to others who may find this useful. If you have any questions or comments, please do well to leave them in the comment section below. Now, let's box on. First thing is you need to graduate medical school. Upon graduation of medical school, you will need to contact the Ghana Medical and Dental Council for their licensure examination. You may ask, what's this council about? The Ghana Medical and Dental Council is the regulatory body of medical and dental practitioners in Ghana. Medical doctor or dentist is supposed to be registered and be in good standing with this council in order to practice medicine in Ghana. Failure to do so is a crime and it's a punishable offense. After your graduation, you would need to pass the Medical and Dental Council licensure examination. In order to sit for this exam, here are some of the things you need to know. You will need to pick up a registration form, an examination registration form from the council office in Tudu, in the Greater Accra region of Ghana. You would also need to have passport pictures. You also need to present certified copies of your degrees and transcripts, and also your high school, secondary school, WESC examination certificate. You would also need 2 medical doctors as your referees. If you plan on sitting for the examination, I would personally recommend that you at least register 3 months to the exam. You may ask why? Isn't 3 months too long? No, it's not. I recommend 3 months because the council will need to contact your school or your medical school to make sure that your certificate is genuine, to make sure everything you're presenting to them is legitimate before they give you the go-ahead. And this may take time. So in order not to find yourself in any trouble, do well to plan ahead. These examinations are usually written 3 times in a year, in February, in June, and in October. So you pick the month you would like to write and then you do as needed. After the verification of your documents, you will need to make payment for the examination. It's usually, the fee is usually quoted in US dollars, and the council will give you the rate at which you can pay in Ghana cedis. And it's supposed to be paid into the council's account. It's an EcoBank account. They will give you the details. You can also find the details on the council's website. After payment of this registration fees at the bank, you will present the bank deposit slip which the bank gave to you to the council, after which you are issued a Ministry of Health receipt. This receipt shows that the council has received your payment. After this, you would also be called at a later date. Usually, the council will call you maybe a week, maybe a few weeks to the exam to pick up your index number and your exam schedule. One thing is, with exam of this magnitude, you were supposed to, be informed of the date like way ahead, but we didn't get it that way. We were told to pick up our index numbers and our schedule on a Monday, and that Friday of the same week we had to sit for the exam. So yeah, you never know the date until you pick up the forms or the registration, your index number. So after registration, after payment and all that, whilst you're at home, I would urge you to prepare, to do all you need to do, because because you are not given much time to write to prepare for the exams after you pick up your index number. It's just like you go like the exam is usually written on Friday, so the exam is in actually 3 sections. The first section is the multiple choice question, or the MCQs, which are done in the morning. You're supposed to be at the venue very early. I think during my time, we were asked to be at the venue around 7 a.m., but I got there before 6 a.m. because nobody wants to get stuck in Accra traffic, especially on a Friday. So to be on the safer side, I would advise you to at least get to the exam center around 6 a.m., 6:30 maximum, because you don't want to be caught in traffic. And sometimes if you present to the examination center late, the supervisors may decide to not let you sit for the exam, because apparently if you come in late, you're going to cause a distraction and all that. Yeah. So let's prevent that from happening. So the MCQs are done in the morning, with problem-solving questions done in the afternoon. I would advise you that you try to bring along with you some breakfast, especially if you leave home very early in the morning and you're not used to eating that late. At least bring some food with you. Even though the council provides us with food such as meat pie and other snacks, usually they're meat pie, soda, or fizzy drinks, and a bottle of water. It contains other small chops like grilled chicken, like a small piece, and then other pastries, in a neatly packed container. So these will be given to you after the MCQs, and between the MCQs and problem-solving portion, you'd have about 45 minutes to an hour, or was it even 30 minutes? So let's say 30 to 45 minutes to, get something to eat and then rush back in. Yes. So these are the things you need. You would also need to present your passport, copies of your passport. Once you pass your licensure examination, you will go through an ethics ceremony and an induction ceremony as well. These two ceremonies used to be done on 2 separate days, but during my time last year, we had to do all ceremonies in a day. We did the ethics seminar in the morning, and we had our induction in the afternoon. Due to COVID protocols, friends and family were not allowed into the hall. It was just us, the inductees. Also, after the induction, there is a very long waiting period. That's where I am now. We are all so anxious, waiting to be placed so that we can start working, because we've been home for a very long time and we need to start working to contribute our quota to building a better Ghana. Yeah, so after your induction, you may wait up to 3, 4, 5 months or even 6 months before you get posted. Yes. And then when you get posted, you will work as a house officer or junior doctor under the guidance of your senior colleagues. Housemanship training is a 2-year mandatory training. During this 2-year period, you will be trained in the major components of medical practice, which include obstetrics and gynecology, internal medicine, surgery, and pediatrics. These are done within 2 years, and each rotation takes 6 months. So, and each year you're supposed to do 1 surgical and 1 medical. It's usually like for medical you get pediatrics, and then for surgical you get surgery. Or you can get internal medicine for medical and obstetrics and gynecology for surgical. You'll be placed for the first year, you're supposed to be in a teaching hospital. First year teaching hospital. But then after the first year, some may be placed in district hospitals, while some may continue working in other teaching hospitals as well. Yes. The housemanship training, even though it's a 2-year program, but it may be extended due to some circumstances. So there are people who may end up doing 2 years and 6 months of house job, or even longer. You never know. Once you complete your housemanship, You will then become a general duty doctor or a general practitioner. And then you'll be granted your permanent license. Note that after you pass your exam, after your ethics seminar, after your induction ceremony, you'll be given a provisional license number. This provisional license number, even though you're a doctor, but you're not allowed to, see patients independently. You're not allowed to work independently because you are in an apprenticeship program. The house job or housemanship training is an apprenticeship program. So you would have to work under supervisors, consultants, specialists, residents, medical officers. And then once you're done with the housemanship, you become a medical officer. That's basically like a general practitioner. Yes. And then from a medical officer, you can then go on into residency to become a specialist, a consultant, or you just decide to stay a medical doctor. Either way is cool. We need everybody. Yes. So thank you so much for joining me today. Thank you for watching my video. Don't forget to subscribe. Please like. These are very important to me, okay? Like for more videos. Like so that I can get the motivation to make more videos for you. And subscribe. Share these with your colleagues, with your friends. Share. And don't forget to comment.